During this video, we'll explain what's involved in calf augmentation, also known as calf implant surgery. This is a cosmetic surgery procedure to enhance the profile of the calves. There are different types of anesthesia for this procedure. The final choice will depend on your personal requirements and the surgeon's recommendation. This could involve sedation, local, or general anesthesia. Full personalized details will be included in the written consent information. The operation can be done by making a cut or incision in different places. The exact length and location will vary depending upon your personal requirements. An incision is usually hidden in the skin crease behind the knee. The skin, fat, and muscle are loosened with surgical instruments to create a pocket to hold the implant. An endoscope or other surgical tools may be used to keep the incision as small as possible. 1 or 2 implants are slid into place and may be secured with sutures. The same will be done to the other side. The surgeon will make final alterations to make the treatment area as symmetrical and natural looking as possible. The surgeon may leave a drain in the wound to remove any excess fluid. This is usually removed within a day or 2. Finally, the skin will be closed with sutures, glue, or skin closure tape. You may be fitted with compression bandages and dressings. There will be some bruising and swelling in the first few weeks. However, this will settle with time. The scars will heal over months and years to become thin, faded lines. However, it's important to note that there will always be visible scars. By hiding them in natural skin folds, they should be less noticeable. In time, once you've fully healed, you'll notice your new body contours. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.